I want to begin with an outspoken critic of the compromise to end the longest ever government shutdown. Democratic Congressman from California, Mike Levin, he says that he'll be a hard no on the bill to reopen the government tomorrow. And let's ask him specifically why. Welcome, Congressman.
Thank you.
We know there's been a lot of pain. There's been a lot of fight. There's been a lot of frustration. People want the government open, but not at any cost. What is your cost?
Well, you laid it out really well in your open. I have spoken with literally dozens of my constituents whose health care premiums are doubling or tripling or worse. I spoke to a 62-year-old retired teacher who is going to have to take Social Security early to make up for the $700 a month he's going to have to pay in extra health insurance premiums. I spoke to a working mom with a husband and two kids who's going to have to pay $55,000 a year for health insurance and is worried about bankruptcy because of medical debt. The stories go on and on, Laura, and the Republicans have done absolutely nothing to address any of this in this awful bill that they're sending us tomorrow. And so I'll be a firm no. I hope that the overwhelming number of my colleagues in the House, the Democrats, will stick together because this really doesn't solve anything, and they are totally in denial about this healthcare crisis that they have created.
But that won't be enough in order to stop it from passing, right? What will you do if it does?
Well, we're going to have a discharge petition. Already, Leader Jeffries, and all credit to him and our House leadership for sticking together through all of this. He has said we're going to have a discharge petition, meaning we're going to have 218 members of Congress sign, and that'll force a vote. But even,
do you have those votes?
I hope we do, Laura. I would say if you look at the Republicans who said that they would support at least a one-year extension, I don't think that's enough.
Jeffries wants 3.
Exactly right. So I'd like 3 as well. But even if we could get 218 votes for a one-year extension, that's a start. I'd like to see a 218 for 3. Get that vote up or down, put everybody on the record. And look, here's the thing. The Senate, Thune is now promising they're going to have a vote in December. But even if you get 60 in the Senate, there's absolutely no guarantee Johnson will actually hold that vote, absent being forced to be a discharge petition. So that's the mechanism we're going to have to use. By the way, it's the same mechanism we're using to compel the release of the Epstein files. So it's going to be an interesting December in the House of Representatives.
Grijalva says she'd be that final vote to do just that. This is, of course, a very different issue in the sense of if there's no trust, even to keep the government open under the promise that there'll be a discussion later about the ACA, can you really suggest that there's going to even be a fruitful conversation or a realistic one about a 3 or a 1-year extension?
I think there are a certain number of Republicans that are at least open to it and have said they would support it. And we've got to try, Laura.
Are they privately supportive and then publicly showing that they don't want to do it? I mean, this is the frustration for every voter. They hear about Republicans or Democrats in some spaces where privately they're on your side. And then publicly mum's the word.
There are a handful that are publicly for it, and they've said that they would support at least a 1 year. There are many others that are privately for it because they know it's going to hurt their communities. The ACA actually has a higher per capita number of people in Florida and Texas than it does in my home state of California. But these stories are real. And if I'm hearing them, presumably any member of Congress worth anything is hearing them too. That, of course, presumes that they're actually listening to their constituents, Laura. And I don't know where these Republicans have been for the last 54 days. I don't know if they've been hanging out at Mar-a-Lago at the Great Gatsby party. I don't know where they've been. They sure haven't been in Washington, D.C., because just about every week I've tried to come back to D.C. and have conversations with my colleagues across the aisle. I'm on the Appropriations Committee, so there's a big appropriations element to this bill as well. We've had no meetings, no discussions, not even exchanges electronically with a lot of these folks. They have been told by Mike Johnson not to work with us, not to speak with us, and they are completely subservient to Trump. I would say Mike Johnson, as you look at the history of the House of Representatives, will go down as historically the weakest speaker in the history of the House. When you contrast that with Nancy Pelosi, who'll go down as one of the all-time greats.
And yet, this is the longest shutdown in government history. He is at the helm on the House side. You've got the Senate. Obviously, Republicans control that. Senator John Fetterman, he says that the collateral damage to everyday Americans, regardless of what you're talking about and what the principled arguments are being made, that was a bridge too far for him. Listen.
I think my party crossed a line of now putting 42 million Americans with their SNAP benefits, and making flying less safe and that kinds of chaos, and not paying our military. I mean, that was a red line for me that I can't cross as a Democrat.
He's blaming your party.
With all due respect to Senator Fetterman, there was money for SNAP in a contingency fund, $6 billion, of which at least $4.5 billion was sitting there. And the Trump administration did everything possible to prevent that money from going to people in need. They actually used hunger for leverage, including the hunger. We're on its Veterans Day today, of over 1 million veterans on SNAP. That's disgraceful, Laura. And
even beyond SNAP, what about federal workers, air traffic controllers? This is the frustration that people are. I mean, in the Beltway,
absolutely,
it's huge, but outside,
I'm frustrated too. What frustrates me the most about some of these federal workers, these are our congressional staffers. Each one of us members of Congress, we've got staff who work for us, and members of Congress, by the Constitution, got paid this past Friday unless they opted out, which I did. I'm trying to get to the bottom of which members of Congress took the pay. If you think about it, here at CNN, let's say if the boss took their paycheck and everybody else got nothing, how would that make you feel? That's what some members of Congress did last Friday.
Not to mention the American public who did not receive their paychecks, and many federal employees in food lines, and the collateral damage of those who are in need of the resources by that breadwinner in their family. Let me ask you, because you've said that it's time for Senate Democrats to move on from Senator Chuck Schumer's leadership. Leader Jeffries, once again, is refusing to say what he feels about those particular calls. Listen to what he had to say.
We're focused right now on pressing the case in addressing the Republican health care crisis. We'll be before the Rules Committee in moments. We'll have a family conversation as House Democrats. We're strongly opposed as House Democrats to this reckless Republican effort.
Should Schumer survive politically?
Well, first, let me say Leader Jeffries did a tremendous job in keeping us all united during this difficult time. And for whatever reason, either because Leader Schumer wouldn't keep his Senate Democrats united or couldn't keep them united, in any event, what happened was unacceptable. And what happened is we all in the House, we hung together for 7 weeks. And all we were asking is for Senate Democrats to stay in that fight with us, day in and day out, for the American people, for health care for millions and millions of people who are at risk of losing their health insurance. And unfortunately, 8 Senate Democrats decided not to do that. You'd have to ask them the reasons for that. I can tell you only if I were in the Senate, I would say it's time for new leadership. That'll be up to the senators to ultimately decide which direction they go.
We will see what happens, especially tomorrow. Thank you so much for joining.
Thank you, Laura.